All right, time now to turn our attention to a little bit of medical news this morning. And certainly 2020 has been the year where we really need to make sure that our health is our top priority. And of course, one of our guests, who I'm so happy to see this morning because it's been too long, from Peaks of Health this morning, we have Dr. Tracie Leonhardt joining us. And again, so good to see you. I know, again, as I just mentioned, keeping our health a priority is more important than ever. And so happy to hear your doors were open this whole time in 2020.
Yeah, we never shut the doors. I do urgent care on top of everything else we do. And some of the things are unbelievably important to our patients that, they don't lose their care at that point. So no, I never stopped working at all.
Yeah. Well, again, we have missed you. I'm glad you're joining us again this morning. This morning, out of all the topics, I thought this was interesting that you wanted to focus on this one this morning, and that's testosterone. And I think when you hear that, you assume that that's mainly for men, which it is, but women as well can benefit from this. Talk about the importance of testosterone and why you wanted to talk about that this morning.
Well, I think it's huge in a lot of things, especially everybody going through stress and things like that. And testosterone is huge in your energy levels, your health, your bone health, your immune system. It's actually part of that immune system. Weight gain. A lot of people are starting to gain weight during COVID because they've been staying home so long. So it has a lot of things in terms of mood, depression. So this is one of those hormones that's going to decline when all this is happening. And it's unbelievably important for both, again, men and women.
So how do you know then if your testosterone levels are getting too low?
Well, part of it, women lose half their testosterone by the age of 40. So that's where they're starting to gain weight. They're starting to feel more sluggish. They're starting to forget things. This is even before their estrogens decline. Their bone health is important because, again, it's a big part of osteoporosis. It's also very protective to the breast tissue as far as breast cancer is concerned. So it's really important in those cases. For men, they're, again, a little irritable, moody. They're starting to gain weight around the middle. They're not as strong in the gym, or if they're exercising, they don't feel as strong. They may have sleep issues because, it can cause insomnia, fatigue. So there's a lot of things that can go on with this level starts going low. So if you just don't feel like yourself anymore, it may be one of the things that's happening.
So how easy is it then to add testosterone back to your body? How do you make sure you're getting the right levels? What do you do?
Well, if somebody's young, then we look to see why they're not making it anymore and try to fix the problem. But as you age, then it's a replacement issue. And at that point, you can replace it by a sublingual Tracie, which is a little lozenge that goes in the mouth, a topical cream that you can rub on every day. You can replace it by injectables, mostly in men. And then my favorite is hormone pellets because I get them put in and I don't have to worry about them, for the next 4 months. They're just there. So it's an easier thing for me because I constantly forget to do the creams.
So I'm curious, if your testosterone is low, is it likely there's other things going on as well, or can it just be a testosterone issue? I mean, obviously, I love what you do with your team and when people come in, because you really look at the big picture. You kind of look at everything.
It can be just testosterone. And, when women are younger, as they age, they're going to lose their progesterone, they're going to lose their estrogen, and it's a combination. I mean, if I had to pick over one hormone over all the others, I would probably pick my testosterone over my estrogen for what it does for me. I mean, it helps keep me leaned out. It helps my muscle mass. It helps my mood. It helps my sleep, So, and on top of that, we have a lot of women who've had osteoporosis. It actually reverses it instead of just treats it. Sex drive is a nice, important, factor of it, but that is, down on the list of all the things it does for you. So it's just one of these hormones. There's a new book out that's called Testosterone Means More for Women that actually says that testosterone is probably a more important hormone than actual estrogen in women.
And that's
so we have some women that only get testosterone.
People don't think of that. They assume that it's just, essential for men.
It is. It's heart protective. It's brain protective. 50% reduction of Alzheimer's with testosterone affects the plaquing that occurs with Alzheimer's in the brain. And that is men and women. That's where I started researching testosterone because my father died of Alzheimer's. And so I wanted to see what you could do about it. And that's where I started learning so much about it and so much what it did for the body.
So what do you want to do? What do you, people watching this morning, they want to find out if they would be a good candidate for this. What's the best place to kind of start and wrap your head around this and maybe get something done about it?
Yeah, the best place is probably to call the office for a courtesy consult. We do 15-minute consults to see if it's right for you. Then we check your lab work, and then we discuss all your options for treatment at that point. So anybody can call the office at 727-826-0838 and request that consult.
Well, we've been showing your website there as well. Doctor, again, so good to see you. Glad you're doing well. Thank you for what you're doing for the community, and we look forward to hopefully seeing you again soon. We'll, of course, put all this on our website, too.
Thanks, Carly. I appreciate it. It's great to be back.
Take care.